Millions of Americans are opening their refrigerators to take a weekly injection, completely unaware of a hidden trade-off happening inside their bodies. We aren't just talking about a little bit of nausea here. Across the country, a quiet crisis is brewing, as everyday users report everything from sudden, terrifying vision changes to a level of exhaustion that leaves them completely bedridden. This video is made for your benefit, so quickly like the video and subscribe to the channel. I am Dr. Jamie. Let's go to the topic. We all know how semaglutide took over America. It went from a standard type 2 diabetes treatment to a viral Hollywood obsession and a TikTok phenomenon overnight.
Curious. But as the initial hype settles, the real-world data is starting to pour in, and it reveals a much more complicated story. Today, we're stripping away the marketing gloss to uncover the exact side effects doctors are growing increasingly worried about, including a bizarre physiological shift that actually worsens after you drop the pounds. Stick with me, because we're also exposing a rare but severe complication currently baffling top researchers. And it's something you absolutely need to know before your next dose. Let's start with the hurdle almost everyone bumps into first: the relentless digestive upheaval. The most common complaint across American clinics is a deep, persistent wave of nausea. To understand why this happens, we have to look at how this medication actually alters your biology. It works by mimicking a hormone that drastically slows down gastric emptying. In plain English, food sits in your stomach for hours, sometimes days, longer than it normally would. Have you ever tried to go about your workday while dealing with the phantom sensation of a Thanksgiving dinner that simply refuses to digest? For many, this biological slowdown triggers an intense cascade of bloating, acid reflux, chronic constipation, and sudden bouts of diarrhea. On forums like Reddit, thousands of users describe a reality where they can barely tolerate the sight of a meal, living on ice chips and crackers for days following their weekly shot. While clinicians note these symptoms frequently spike during dose escalation and tend to taper off, a growing percentage of patients find that their digestive tracts simply never adapt to the modification. But as uncomfortable as a messed-up stomach is, it's nothing compared to the overwhelming physical shutdown hitting users a few weeks into their regimen. We need to talk about the profound, bone-deep exhaustion that users are calling GLP-1 fatigue. This isn't the typical mid-afternoon slump you can fix with a double shot of espresso. This is a heavy, limb-weighted tiredness that turns everyday tasks into monumental chores. A massive data analysis looking at more than 400,000 social media posts confirmed that debilitating fatigue is one of the absolute most frequently reported complaints from patients taking these medications. Here is the twist. A lot of this exhaustion isn't actually a direct chemical side effect of the drug itself, it's a systemic side effect of accidental starvation. Because your appetite is so thoroughly blunted, your daily caloric intake plummets off a cliff. Your body suddenly finds itself running on a severe energy deficit, struggling to secure the basic fuel it needs to keep your brain firing and your muscles moving. Mix that extreme calorie drop with subtle dehydration, since the drug also dampens your thirst cue, and your metabolic system goes into a defensive, low-power mode. You might be dropping weight, but you're paying for it with your cognitive clarity and daily vitality. And unfortunately, that extreme energy deficit can end up altering more than just your mood. It can fundamentally change the way your face and body look in the mirror. When people step on a scale, they naturally assume every pound lost is a pound of unwanted fat. But human biology doesn't work that way. Clinical trials show that a significant percentage of the weight dropped on semaglutide actually comes from lean muscle tissue, not adipose fat. When you lose weight at a rapid pace without intervention, your body cannibalizes its own muscle mass for structural energy. This structural loss explains the viral phenomenon known across America as Ozempic face. It's a look characterized by hollowed-out cheeks, sagging skin, and an suddenly aged appearance. For a 20-something looking to fit into a dress, this might just feel like an aesthetic annoyance. But for an American over 50, rapid muscle wasting is a genuine medical hazard. It compromises joint stability, tanks your metabolic rate, and drastically increases the risk of balance issues or dangerous falls. It's exactly why metabolic specialists are now begging patients to prioritize heavy resistance training and aggressive protein intake. Because if you aren't careful, you might trade a waistline problem for a structural mobility crisis. Yet, as concerning as muscle loss is for long-term health, there are even darker, more acute warning signs that require a trip to the emergency room. While mild discomfort is common, there is a clear line where a side effect transforms into a medical emergency. The FDA-approved safety labels explicitly warn of rare but severe complications like acute pancreatitis, gallbladder disease, and acute kidney injury. If you ever experience a sharp, agonizing pain in your upper abdomen that radiates straight through to your back, accompanied by non-stop vomiting, that isn't just a standard stomachache. That is a critical red flag that your pancreas is under severe stress. But the medical community was recently rocked by an entirely different concern, a potential connection to a rare condition that causes sudden, irreversible vision loss. A series of observational studies noticed an unexpected cluster of a condition called NAION, essentially an eye stroke, among certain semaglutide users. While international researchers emphasize that a definitive cause and effect relationship hasn't been set in stone, the statistical link was strong enough to make top ophthalmologists take immediate notice. It serves as a stark reminder that when you manipulate systemic hormonal pathways, the ripples can travel to the most unexpected corners of your anatomy. In fact, some of the most striking anomalies aren't happening in clinical labs at all, but rather inside the daily lives of patients dealing with altered senses. Step away from the clinical papers and spend an hour reading real-world body diaries, and you'll find a list of bizarre sensory shifts that early clinical trials barely touched upon. Users frequently report a persistent metallic taste in their mouth, a constant feeling of being physically freezing cold, and sudden, unexplained nighttime anxiety. Perhaps most fascinating of all is a psychological shift that researchers call an anhedonic dampening of basic human desires. Because these medications interact directly with the dopamine and reward centers in your brain, they don't just turn off your craving for a slice of pizza. Many patients report that their desire for a morning cup of coffee, a weekend glass of wine, or even hobbies like online shopping completely evaporates. For some, this neurological quiet is an incredible blessing that breaks a lifetime of compulsive behavior. For others, it feels like the color has been completely drained out of their daily life, leaving them feeling emotionally flat and disconnected from things they used to love. When you add up the physical sickness, the constant exhaustion, and the loss of daily pleasures, it becomes highly obvious why a massive number of patients end up making a choice nobody talks about. They simply quit. Navigating the wild world of modern healthcare gets tougher every single day, which is why we break down the real science to help you protect your body. Hit that subscribe button right now so you never miss an honest, unbiased look at the medical trends affecting your life. Drop a comment below. Would you ever take an injection like this? And if you want to know what actually happens to your metabolism the moment you stop taking these shots, click on the next video popping up on your screen right now. Stay safe out there, and I'll see you in the next one. Quick reminder before we dive in. Today's video is strictly for educational purposes, so please always consult your healthcare provider before making any medical decisions. Imagine waking up, stepping on the scale, and finally seeing the number you've targeted for years, only to realize you feel too physically miserable to enjoy it.